thank you so much. Like, we will have a time later for questions, so we will gather all the questions from audience and members of committee, and the questions that please ask online. Yes, that people can ask online. So we will address all these questions, as many as we can, during the question session. So our next speaker is Jennifer Alexander. She's research scientist with RTI International Center for Communication Science, and an adjunct faculty member at George Washington University Institute of Public Health. She led several qualitative studies examining the use of and perception of electronic cigarettes in diverse populations, including seniors, youth, healthcare professionals, and transgender men and women. Please.
Thanks, and good morning. I appreciate the invitation from the committee. So here is a list of some of the issues that I'm hoping to cover. I'll be talking about the research that I personally have conducted over about the past 5 years. This is all qualitative research, and I'm going to discuss, first of all, what that means. These are studies with adults, young adults, so 18 to 24-year-olds, and with youth. And generally, youth are defined in our studies as 13 to 17-year-olds. So a quick note on qualitative research. It's intended to give a richness of data that can give a useful snapshot of an issue, such as reasons for youth initiation, for example. It's often able to spot trends or patterns that may not be found through survey research, for example. My goal today is to perhaps fill in some of the gaps and raise some questions going forward for the committee. We deal in words rather than numbers as qualitative researchers. We use many different methodologies. Individual interviews, dyads, triads, focus groups are just a couple. In qualitative research, we often use semi-structured moderator guides, so we're able to kind of ask probing questions afterwards. It's very dynamic, it's exploratory, descriptive, and it really does complement quantitative research really well. A couple of limitations, however, to qualitative research. It's not generalizable to all youth, all adults, all e-cigarette users, or all anybody. However, we often strive to conduct research in varied geographic locations or with varied audiences, with a mix of race, ethnicity, socioeconomic status, and education to reach a cross-section of participants. We also try to use purposive samples with participants that we select based on characteristics of a larger population. We also use smaller samples than in quantitative research. The studies that I'll be referencing today range from anywhere from 35 participants to about 100. So I'd like to talk about e-cigarettes. First of all, I want to start with terminology. And as you can see, the Oxford Dictionary's word of the year in 2014 was vape, and they meant the verb and the noun in this case. Terminology is not that clear-cut. So it's fast-moving as new devices and products are introduced and others fall out of favor. It's also dependent on age and geography of users. There is, however, one unifying factor, and that's confusion. There's confusion in how to identify devices among researchers, agencies, and also among users. So I noticed, for example, in the committee statement of task that they're referred to as both ENDS and e-cigarettes. There's no one way to refer to these products. In a paper published last year in Tobacco Regulatory Science, my FDA and RTI co-investigators looked specifically at terminology and found that it was difficult for users to describe the differences between types of devices. In that study and in some more recent ones, we researchers generally sort the devices into two different groups. So cig-alikes, the first picture up there, and then tanks, which would be the second and third photos. And that's how I'm going to refer to them today. But that's not what they're called by users. Users call them e-cigarettes, they call them by the brand names, pens, tanks, vapes, mods, some things that I'm sure I've never even heard of. We find that when we recruit users for our studies, we have to be sure to include a description of the devices and sometimes even a photo of what kind of devices we're hoping that they'll be using. And that doesn't even necessarily always work for us. It doesn't always get us the users of the correct devices. The act of using is complicated as well. Cig-alike users, who are often cigarette smokers who are looking to quit, say that they smoke their e-cigarette. Some tank users also use the verb smoke as well. Vaping, or to vape, is generally well known, and it's a recognized term, but it's not universally used. When it is used, it's used most often by youth and young adults. In our terminology paper, we talk a little bit about the stigma against cigarettes that some users consider when discussing terminologies for their e-cigarette use. For some, even as they say they smoke their e-cigarettes, they make sure that they use that qualifier, that they're smoking an e-cigarette. Others very intentionally use vaping and point out that they're vaporizing liquid and not smoking tobacco. No one wants to be confused with a cigarette smoker. I'm going to talk a little bit about use and culture. We see that peer and family influences are at play for both adults and youth. They often initiate use with a device from a family member or friend. Importantly, though, youth continue to use shared and borrowed devices. It's become harder, though not impossible, for youth to buy their own devices and e-juice, even when they have the disposable income to do so. We found that youth use cast-off devices from family members and often share them amongst themselves. When asking about reasons for continuation of use, there are differences among age groups. Adults and young adults often use these devices to quit combustibles. Both groups also supplement their cigarette use with e-cigarettes, using them in places where they couldn't or wouldn't smoke cigarettes, such as inside homes, at work, and in the car. They use them to manage their nicotine cravings. Adults and young adults who are either exclusive users of e-cigarettes or dual users with cigarettes often discuss how much they enjoy being able to participate in the social aspects of cigarette smoking without having to use combustibles. A note specifically about flavors. Adults discuss the importance of flavors depending on which device they use. Tank users find flavors more compelling than do cig-alike users. Young adults and youth both talk frequently about flavors as a reason, an important reason, that they use e-cigarettes. There's also a sense that they're popular among their peers. They're cool, they're trendy, but interestingly, youth are very vocal and sophisticated about this trendiness. They're prepared to move on to the next big thing when it shows up, and when they change peer groups, such as when they go to college. In some parts of the country, we've been told that they aren't as popular as they were a couple of years ago. Youth also use them, of course, because they can do tricks, because they want to experiment with something that they think will be safer than cigarettes. They say, we're going to experiment with something, we want to pick something that's safe. We've asked users what the benefits are to using e-cigarettes. What do they get from using e-cigarettes? Most often, adults will tell us that they're a way to quit or reduce their cigarette use. There's also the benefit of convenience, being able to get their nicotine fix in a place where they wouldn't smoke, or they couldn't smoke. There's no ash, there's no butts, it's seen as cleaner. It's also perceived to be healthier, and we hear from users that it's a lot of fun. Much like there's differences among age groups as to why they're using e-cigarettes, there's also differences in which devices they choose to use. Adults, many of whom, as I've said, are using e-cigarettes to quit combustibles, choose cig-alikes because they most closely mimic their smoking experience. They're not looking for a new or a different experience. Their use is utilitarian as a way to address their nicotine addiction. Young adults may also use cig-alikes if their primary reason for use is to quit smoking. But this is the age group where we start to see the hobbyists, those who are using the tank devices for the pleasure of using them, not to necessarily replace combustible use. And I'll talk a little bit more about that in a minute. Youth are very clear when asked. There is no reason to use a cig-alike at all. There are limited flavors, there's limited vapor. You can't perform tricks with a cig-alike. The youth we talk to would never choose to use a cig-alike. That said, what's notable about youth is that they don't always get to choose what device they use. As I mentioned, there's a subculture of young adults and youth who use tank devices. I'd suggest that these are actually two separate hobbies at play. One involves modifying or building devices, while the other involves doing tricks with vapors or trying to cloud chase, which is where users try to make the biggest clouds they can. And both of these groups have some overlap with making their own e-liquid, as Spike mentioned. In talking with youth, vape tricks are most of interest. Building mods can obviously be an expensive hobby. Certainly, if you've spent some time on YouTube, you can see videos of vape tricks and cloud chasing competitions. I want to talk a little bit now about youth users and family norms. So, much like Spike, I enjoy memes. This is a meme I pulled from the internet to make the point that one would expect to hear that parents aren't necessarily all that happy when they find out that their child is smoking cigarettes. And we might assume something similar when youth are found to be cigarette users by their parents. And that is not necessarily what we hear. This is what we actually hear. On the right are some quotes from youth in a recent study who are regular e-cigarette users. We heard that the majority have family members in their home who also use e-cigarettes, either older siblings or parents. In some cases, family members bought or gave them devices. In other cases, youth borrowed or otherwise liberated devices from family members. Older youth, so I'm talking about 16, 17-year-olds, reported that their family members actually bought devices for them when they found out that their child was smoking cigarettes. We asked youth if their parents knew that they used e-cigarettes, and if so, what their parents thought about it. Overwhelmingly, we heard that when youth had another e-cigarette user in the home, the parents had positive or neutral feelings about their child's e-cigarette use. But even when youth did not have another e-cigarette user in the home, they often still said that parents were accepting because, and this is a quote, "at least it isn't cigarettes." I want to address some perceptions of health effects that we hear from our research participants. Across studies, we often ask participants what they know or what they've heard about the health effects of e-cigarettes, and we hear very little. Users are aware that they don't know much about health effects. The most frequent concerns that come up when we ask about health effects are device safety issues like explosions or leaking e-liquid. There is, however, a real desire for information. Across the age spectrum, we hear that users would like to know the health effects and that they expect that bad news is coming. Those youth users from our recent study say that they'll stop using e-cigarettes when either it isn't cool anymore or when they hear about negative health effects. This, of course, doesn't take into account whether they'll be able to quit when that time comes. Health effects and addiction are usually expressed in comparison to cigarettes. There's an overwhelming perception that regardless of what we find out about the health effects, it definitely won't be worse than cigarettes. A note about perception by users of health effects on non-users, because I know that's a topic of concern to the committee. As I mentioned earlier, one of the benefits seen by users is that they can use them in places they would never be able to or never choose to use cigarettes. Often, adults use them in homes around non-users, including their children. There's a perception that the vapor is harmless, and while users take pains to keep their bottles of e-liquid safely out of the hands of their children, they've often described to the researchers, to myself and others, how much fun their kids have when they blow those delicious-smelling clouds of smoke, or vapor, right into their faces. I'm going to talk specifically about nicotine for a minute. Addiction to e-cigarettes is identified by users as addiction to nicotine, with an understanding among adults that there's a behavioral hand-to-mouth component as well. Overall, youth and adults are reasonably well educated about the effects of nicotine. But one of the interesting nuances we found when we've talked to youth is that while they know that nicotine is addictive, because they've heard it in health class and they've heard it from PSAs about smoking, they don't always get a say in whether or not they use it. When asked, youth will tell you that they don't use nicotine in their device. But once we ask them, how do you know that? And we always do, they can't say. They share or borrow devices and e-liquid, and they don't know if they're using e-liquid with nicotine. They don't get to choose. They ask their friend who got the device or the e-liquid from an older cousin, and the friend says, no, there's no nicotine in there. And this, of course, doesn't mean that there's no nicotine. Finally, I was asked to talk a little bit about and give some input into how to assess qualitative studies. I would not presume to be the expert on this, but I do want to give a little bit of feedback to the committee. In this particular case, I'd suggest that it is crucially important to ensure that study participants match your population of interest. So for example, if you're looking for qualitative data on youth who use e-cigarettes, seek out studies where the participants are under 18 and are regular users and not necessarily ever triers or ever users. Those studies are starting to be out there. The most interesting studies to me personally are often those that use a purposive sample rather than a convenient sample. In these cases, particular individuals, like I said earlier, are chosen with characteristics that are relevant to the study, who are thought that will be the most informative. For example, We want to study differences between device users, so we recruit tank users and talk to them. And then separately, we recruit cig-alike users and talk to them. Sometimes, however, we're limited to convenience samples, and there's no problem with that. Those are the participants who are most accessible. Data analysis ranges from software programs such as in vivo to a matrix approach where you look at notes, and both are appropriate. There's lots of appropriate ways to analyze qualitative data, but it's important to be able to understand from the write-up what analysis was conducted and why. We often present findings as themes with illustrative quotes, and there should be a discussion of this as well, that they're illustrative and not limited to only one participant said this. They should be illustrative of the majority or more of the population that was studied. This is my contact information, and again, some memes, particular to health effects.
Thank you so much.